Hi, I'm Andrew Sears, and I'm the president of City Vision University, and I'm going to give you an overview of what makes City Vision's addiction counseling programs unique, particularly on our graduate programs. So, the design approach to City Vision's graduate programs in addiction counseling, we're really trying to do three things. So, we're trying to align our courses with general counseling, and that is aligned with licensed professional counselor standards that generally comes from the body called CACREP. We aren't CACREP licensed, but we are aligning um, with their standards. So then there's addiction specific integration. So that's something else that we provide that's unique. And then there's Christian integration. So if you're going to compare City Vision's program to other programs out there, you're going to have other masters in Christian counseling that's going to have these two components. Then you're going to have Christian masters in addiction counseling that typically have these two components. Often they're not aligned directly with CACREP standards. They can't stack into a CACREP degree. And then you have secular programs out there that generally they're going to provide the addiction specific integration. So what makes us unique is we're trying to do all three of those things. So to use a more specific example, is we've designed all our courses. Often we're trying to do integration across all three of these domains. So for example, in our course, it's called Family Counseling and Addiction. But the primary textbook for that is a CACREP textbook. So this is probably one of the top two or three textbooks that's used in CACREP and LPC programs. And that's the majority of the content in the course. But we're also using a book that was particularly designed to align with CACREP standards around Christian integration. So it's called Family Therapy as a Comprehensive Christian Appraisal. And then we're using addiction-specific integration. So in this case, we're using SAMHSA's Tip 39. Sometimes we'll use an outside book. So this is substance use disorder in family therapy. So as you take this course, you're getting the benefit of all three of those. And that, with most of our courses, that's how we've designed them. So why is this relevant for you? Well, it's important to understand the professional development paths in addiction counseling. So, the first level, many people realize, is a peer support specialist, and then you go to become a certified addiction counselor. And most people will go directly. And often most states will have a CAC1 or a CAC2. And our courses will help. A lot of our undergraduate courses and even graduate courses can help you prepare for that. But then you have these graduate level certifications. So there's the Master Addiction Counselor certification. Often that's 36 or sometimes 48 credit masters. And sometimes that can build towards a licensed professional counselor. And we've designed ours to maximize the transferability and the stackability of that, particularly for Liberty University's program. Others might pursue master's in marriage and family counseling or a master's in clinical social work. And what's important is that these three licenses are kind of really the top tier, or one of the top tiers in the hierarchy. And most states will require one of these licenses to bill for insurance and Medicaid. And what that means is that makes them better for pay and more marketable. So if you're getting a MAC, it's often good to think about how you could later get one of these if that's where you want to go, if you're becoming a master addiction counselor. Now, another way of thinking about this is a typical org chart of a secular licensed treatment center. You're going to have a chief medical officer usually at the top. That's often going to be a psychiatrist or MD. And then under them usually is going to be LPCs, master addiction counselors, or clinical addiction counseling supervisors. In some states, those are actually billable. In other states, they have more restrictions, and you have licensed clinical social workers. So some states, in a few states, this is almost comparable to these other categories. But often these will be supervising the licensed addiction counselors, who often then supervise the peer support specialist. So the standards that are out there are for addiction counseling. There's SAMHSA's TAP 21 8 practice domains of addiction counseling. So almost all states are going to map to these domains in various capacities. And our courses, if you go through each course, each lesson is going to identify which of the TAP 21 competencies they map to. Now, part of what you have to understand is with Christian integration, the way Christian integration works, it isn't another circle on this. What it's actually doing is we're trying to think about how Christian integration works across all of these and how Christian worldview might impact each of these domains. Now, another way of thinking about this also, as I mentioned, what we're trying to do is we're trying to meet the addiction counseling standards, but also map to LPC standards. So as we're meeting the addiction counseling standards, we are mapping to those. And if you look in each of our courses, for each of our lessons, we're mapping to the LPC standards. And as I mentioned, in most of the courses, the primary textbook is going to be an LPC focused textbook. So the primary mapping is actually LPC mapping. But if you're interested in how SAMHSA maps to KCREP standards, this is an example of a map of how that works. And but I'm not going to go into all the details. The big picture of the difference between addiction counseling and, say, the more general counseling programs, and this applies to KCREP focused LPCs. So addiction counseling is really more street level. It's more working class oriented. I would describe it as non-majority culture, specializes on addiction, more practical training, addiction treatment centered, typically though lower pay. One good thing about it is it has multiple rungs on the career ladder. Often addiction counselors, in my experience, is that they will often encounter people who are licensed counselors that might be doing addiction counseling, but haven't really been trained very extensively in that. So, or they don't have, it's fairly common for people in the field of addiction counseling to have lived experience in this space. So they might judge this other side as being disconnected or not as close. There's the limited ability to bill insurance. Often this group's supervised by LPCs or licensed clinical social workers. This side is clinically focused, often coming from upper middle class dominant cultures, what I would say, majority culture dominant. More general counseling has much stronger theoretical foundations. It's counseling centered in general, and typically have higher pay. The career ladder starts with a master's. Often this side, the LPCs will say that the addiction counselors aren't as well trained. They have the better ability to bill insurance, and they supervise addiction counselors. So, I mentioned there's multiple rungs on the addiction counseling career ladder, and so that's actually SAMHSA's career ladder. And you can see that there's multiple tiers here, and often these map to the different certifications. So you have peer support that you can usually do with high school. And then as you get some training, at various states, sometimes it requires an associate's or bachelor's, depending on the level, but you have level 1 often in level 2. And then at the master's level, most states for a master addiction counselor or also the clinical addiction counseling supervisor will require a master's degree. So for City Vision's programs, we're covering kind of this space here currently. So to provide that in a little more detail, so we have our undergraduate certificate in addiction counseling, that's 6 courses, that builds into an associate's in addiction counseling, that builds into a bachelor's in addiction counseling. And then you have a graduate certificate in addiction counseling that can build into our master's in addiction counseling. And so for these, this is helping equip people for the peer support specialists, and sometimes this certified addiction counselor 1, then you have the certified addiction counselor 2. And here, what we're really trying to equip people for is the master addiction counselor. In some states, that's called the licensed addiction counselor, or the clinical addiction counseling supervisor. So if you want to go on for a pre-LPC and you want to take our pre-LPC track, so there's 2 tracks here. So if you want to go here to do these, you should do our clinical addiction counseling track. But if you want to go on for an LPC, you should be doing our pre-LPC track. So just to be clear, our master's in addiction counseling doesn't equip you to become a licensed professional counselor, but it could stack or transfer to Liberty's program. So which concentration to pick? If you do not plan to pursue an LPC, but you want a master's in addiction counseling, or then you should choose our clinical addiction counseling concentration. If you are not interested in either an LPC or an Master Addiction Counseling, you just want this training for a recovery ministry contact. So this is kind of the most open-ended, the Christian Recovery Ministry concentration. And if you plan to pursue an LPC after this master's and plan to transfer to Liberty University, choose the pre-LPC concentration. One question to consider is why go through City Vision's pre-LPC path versus going directly to Liberty University if you want to pursue an LPC at a Christian university. So number one is City Vision's Masters in Addiction Counseling is very addiction focused. So even though we're aligned with KCREP standards, we have a strong focus on addiction. So if you're working in this field, we're going to go a lot deeper than if you went straight to most LPC programs. The other one's the affordability. So about 3/4 of our students are coming from partners. So through our partner discount, and the tuition of the combined path is quite a bit less. So 37,700 versus 26,000, because essentially you're getting almost half of the degree at City Vision's tuition prices, which are a lot less than Liberty's. And then the third one is, you can get an intermediate credential of a Master Addiction Counseling or Addiction Counseling Supervisor on your path to an LPC. So one really important point, though, is we do not recommend City Vision's pre-LPC track with schools other than Liberty University. The reason for that is most schools don't accept, only accept 25% or less is transfer credit. So you're going to lose a lot of your transfer credits, and a lot of state or government, schools are not going to accept transfer credits from schools like City Vision that are Christian schools. That's just generally how they work. So if you're trying to understand how does this work in terms of the mapping to Liberty University, if you look at, so over here on the left is Liberty University's Master's in Clinical Mental Health Counseling and all the credits that are required for that. And then we've identified the courses that with City Vision that we believe could be accepted for transfer. So we do not guarantee transfer credit to Liberty, but we've designed our courses to be optimized for the transferability. So these courses that are in bold are the ones that we believe that could be transferred. And these other courses that say not transferred are courses that are a part of our program, but Liberty's specifically said in their standards that they wouldn't accept those. Now, part of what we've done, so we've aligned our program with Liberty. So if they're using a lot of the same books, we end up using a lot of the same books. So they said that they would accept transfer credit if it's 80% similar. So we've designed all our courses to be 80% similar. So that's kind of the summary of how we've done that. So the last thing to consider is just what's the full path to become a Master Addiction Counselor. Often there's going to be 4 components. And so this is just an example. And the certified addiction counselor usually is at the undergrad level. So you're going to have education hours. Then some states have practicum, some states don't. Almost all states will have supervised experience hours, and then there's an exam. So for the CADC, you can see how this works. And often for a lot of states, so I'm using this example from Missouri for the CADC, the number of supervised experience hours varies based on what degree you have. So for the Master Addiction Counselor or the Licensed Addiction Counselor in some states is what they call it, most states will require a master's degree. And you should, work with us. We can identify so there's a few states where our master's degree isn't going to work with, and we can, in the admissions process, we can kind of talk you through that, and we'll have a list of those states that are also linked. And you're going to, depending on your state, you're going to have to get practicum hours and you're going to have to get supervision hours. A lot of states will require the Master Addiction Counselor exam. But the key thing is you should be looking up your own state's requirements for addiction counseling certification. So in summary, why pick City Vision's addiction counseling program? It's because we're doing all of these 3 things. So there's a lot of other good options out there if you only want 2 of these 3 things, but if you want all 3 of these 3 things, then we believe that we're a good solution. So if you have any questions, please fill out the form at the top of this site, and we can answer your questions through our admissions office. Thanks a lot.